myself sorted here. Okay, I just, here we go. All right, I just want to say thanks to Nisha for the introduction, and also thanks to Dr. Liao and Chelsea and Lauren for that really great talk on the many benefits of adding palliative care as part of our children's care team. They're a hard act to follow. I'll do my best. But what they shared really actually highlights how beneficial it is when our kids have a care team that is looking at the whole picture from multiple different perspectives. And that's the same thing that's really at the heart of what makes second opinions so valuable and beneficial to consider for our child's care. So, why, right? Why a second opinion? When does it matter? And as we know, when our kids, when our kids are diagnosed with heterotaxy, every child is different. Their anatomy is highly complex. No two kids are ever the same, and that means no two treatment pathways are really going to be exactly alike. So that leaves our families really finding themselves, as Nisha mentioned, really weighing major medical decisions about what to do with not always a ton of data or potentially maybe understanding about what treatment plans are even available, and that can differ from institution to institution because heterotaxy is so rare. Expertise can be concentrated in different areas across different geographies, and finding the right person who can really speak to your child's specific anatomy may vary. So kind of the benefits of second opinions in a rare condition like heterotaxy tend to fall in about three main buckets. One, kind of a big one, is that second opinions can help increase diagnostic accuracy, again, because heterotaxy involves so many systems and is so complex. The value of an extra set of eyes can help refine a diagnosis or help find something that might have been missed, or maybe just not thought about or uncovered yet. There have not been a lot of studies on this, but there is some survey data that comes out of some hospitals, major tertiary centers that do a lot of second opinions, like the Mayo Clinic for adults and the Cleveland Clinic is another one. And I think there's a survey done, I think it was the Mayo Clinic, in which in their second opinion kind of referral centers, doctors reported back only about 12% of diagnoses were fully confirmed, 21% of diagnoses were completely changed, and about 2/3 of diagnoses were refined or expanded from where they initially started. There was also another study, the kind of a multi-system review that came up with a percentage range of anywhere from 10 to 62% of second opinions led to changes in either diagnosis, there we go, a diagnosis, treatment, or prognosis. So, this makes a clear case for why having another set of eyes look at your child could really benefit an understanding of exactly what they have going on. And the second avenue, even when diagnosis itself doesn't change, we're having technical, I'm not the technically savvy person. Here, we're back. Oh, there's a connection problem. See, never ask me to run your AV. And the second one, even when diagnosis doesn't change, second opinions can often lead to an expansion of what treatment options are available to your child. And again, kind of looking in some of these same studies, one study showed about 1/3 of patients received a diagnosis or treatment options that significantly changed their clinical management. And I think as high as Mayo Clinic study, about 88% of their second opinion patients led to some type of changes to plans of care. And then lastly, even if your diagnosis doesn't change or your plan of care doesn't change, second opinions have been proven to be clearly beneficial to families' feelings of empowerment. Families benefit enormously by the fact that what they come out of this with is usually they feel more confident in decision making. They feel that they better understand their child's diagnosis. They feel more confident in their care plans and moving forward, and they feel more in partnership with their child's care team. So for kids like ours, this kind of increased understanding, increased trust in care teams, increased confidence in the decisions they're making, can really lead to benefits when trying to make some of these complex medical treatment decisions moving forward. So the whys, or the wins, should we say, there are certain inflection points in which, first of all, we should always caveat, there is never a bad time to look for a second opinion. There is no, at any point along your child's care trajectory, you can always feel that that is the right time to look for an opinion. But there are a couple of key inflection points, usually when there's a new diagnosis. That doesn't just have to mean the heterotaxy diagnosis itself, but maybe something's changed. Maybe a new issue has come up. They've been diagnosed with asthma, or something's changed about what their underlying cardiac diagnosis has been. Also, before any type of major medical decision or surgical decision, maybe you're looking at cardiac surgery and trying to decide on timing and exactly what surgery to do. If there's any uncertainty in your care team about what the best pathway is going forward, as Nisha kind of referred to, if treatment isn't being offered, they're telling you there's nothing they can do for your child, or it's not going as expected, or even just as a gut check. Does something feel missing or unanswered? Are you just feeling uneasy with how things are going, and you'd really just like a second pair of eyes to come help take a look? I'd like to, at this time, those are very clear reasons why to get a second opinion. There are some myths about second opinions that tend to make people maybe initially shy away from the idea of doing that. So we just thought we would try to talk about some of those. The first being the really big one, and number one that families and patients will report, is that if I get a second opinion that's going to say, I'm going to upset my doctor, right? They're going to be offended. They are going to think I'm saying bad things about them, or that this means that, I think they're a lousy doctor, and maybe this is a doctor you have a good relationship with, and you don't want to offend them. But the reality is, most doctors are going to support second opinions as a routine part of patient care, particularly when you're talking about rare conditions and complex diseases that benefit from multiple perspectives on their care. When it's, I think, actually important to note that the American Medical Association's Code of Medical Ethics actually has an explicit statement on second opinions, where they affirm that doctors should be supportive of a patient's request for a second opinion. And when they've done qualitative interviews of doctors, a majority of doctors talk about how they respect and affirm patient autonomy. And part of patient autonomy means the ability and the right to seek additional perspectives on their child's care. We are just... All right, we don't... Okay, all right, we're gonna keep doing this. So myth number 2 kind of ties with that, this idea that a second opinion will mean I don't trust my doctor. And again, as we said, good doctors want you to be comfortable with your child's care and are pretty open to this idea of getting a second opinion. But there's also the fact that second opinions can increase patient trust, confidence, and understanding with their primary medical team or a new team that they end up with. So the research, again, around this tends to tell us that patients who seek second opinions, who feel more confident and informed, are more at ease at discussing these things with their medical team afterwards, and by confirming or clarifying diagnoses, second opinions can strengthen trust with their primary care team, particularly if a second opinion is pursued in concert with your original care provider. The third myth is that a second opinion is always going to require travel. And for some families, right, they think this is not logistically possible. It's not like, you know, there's 20,000 heterotaxy experts just hanging out in your backyard, just waiting for you to wave and flag one down. And so often, you know, the experts that we were looking for in a second opinion might be further away. And the reality is virtual options, at least when we're talking about initial record review, are widespread and available. And there are also times in which virtual visits can be arranged after an initial record review with some ideas for initial opinions, and then it can be determined at that point what kind of in-person visits might be needed to follow up with any of those initial impressions. The fourth one is that second opinions are costly. The truth is that, at least, as we said, that initial record review, at least to form opinions, can often be free of charge, and there are established pathways for insurance coverage. So we often can kind of think of these as, you know, that this is going to be cost prohibitive and that's not going to be possible for us. But particularly at major academic medical centers, at least again when we're talking about initial records review, this can potentially be provided to families at no cost if they contact a targeted specialty clinic that does this on a routine basis. And when in-person care is required, in order to be able to provide that in-person opinion, there are established pathways for insurance coverage, and we're going to kind of get into that one a little bit later. And the final one is this idea, again, that a second opinion is only for those who are dissatisfied with their current care. And obviously, because dissatisfaction is a very, very legitimate reason for prompting event for getting a second opinion, that leads sometimes families to, it leaves the impression that the only reason to seek another opinion is when things are going poorly. But even as kind of came up in the palliative care conversation, and in this one, you know, that is just not the case. The idea is that when you have a child with a complex condition, two eyes are better than one. Sometimes you're looking for when you're making nuanced decisions, the more perspectives that you can have on your child's diagnosis and current treatment plans can really just help you to feel more confident in whatever treatment decisions you make. It doesn't mean that you change your treatment team. It doesn't mean that you have to choose a different treatment plan. It simply means that you're getting another pair of expert eyes to come take a look at what's going on with your child. So, if you've decided, you know, maybe, a second opinion I think might be worthwhile for my kid, then we start with, you know, how do you start? And the number one suggestion really, if you have a collaborative relationship with your child's care team, is really start with talking to your child's current doctor. And again, going back to this idea that a majority of doctors will support families seeking second opinions. So how do you choose the right provider of your child to talk to? The suggestion really is to look for the provider who is most involved in the clinical care where you have a question. So for example, if you're looking for a second opinion on a particular type of cardiac surgery or the timing of cardiac surgery, then maybe the person that you approach is your child's cardiologist. If it has something to do with their fever care plan, then maybe you go to the specialist who's managing your child's asplenia or polysplenia. Then we come to, you know, how do you ask? The idea and suggestion is really to pick some collaborative framing, that you are working in concert with your child's care team. You know, something like, we really value your care and expertise. We'd like to get a second opinion just to be sure we understand everything involved in what we're discussing and that we've looked at every option before we move forward. You know, finally, there are obviously, we acknowledge, sometimes, we get it. Not every doctor might be supportive of a second opinion or welcomes that, or sometimes you run into a situation in which you feel like you've lost trust or confidence in some members of your care team and feel it's in your child's best interest to not involve them in getting a second opinion. And then at that point, always just a reminder that it is your right to seek a second opinion for your child. You are fundamentally the ultimate decision maker, and it's your judgment that will determine, what, what and when and how to approach your child's primary care team at that. So how do you determine the right specialist to ask? Right? It's not like when our kid is handed to us with a heterotaxy diagnosis, they come along with the yellow pages that says, here are all the people who know about heterotaxy, and you just flip through and stick a finger there and go, I think this is the one, right? This is a process in which this is knowledge that's not always automatically accessible to us from day one. So what are some of our options? If you have a collaborative relationship with your child's care team, asking your child's current doctor, right? Saying to them, hey, is there somebody you would recommend? The benefit of that is these are people who know your child's care very well. They're very intimately familiar with your child's individual care process. And hopefully they're in connection and relationships with their colleagues who they are familiar with, and then can really use that to your benefit by providing a good match, and then they can have behind-the-scenes conversations that can really help advocate for tailoring that second opinion to the question that you have. Other ways to do that, if your current care provider doesn't have a suggestion, or they're not really familiar, they're unsure, there are ways to review hospitals for data on the volume of patients they see for the particular issue that your child is seeing. You can check to see, do they have multidisciplinary clinics that involve whatever organ systems are involved for your kid that you are looking for an opinion on. What kind of heterotaxy experience do they have? Do they have a heterotaxy clinic? There are also some public databases that you can check for certain types of institutional outcomes. So the Society of Thoracic Surgeons operates a congenital heart surgery database that gives data on outcomes on a whole array of commonly known congenital heart surgeries that are done. You can also become your own Sherlock Holmes. We've all done it as heterotaxy parents. You can search published literature in places like PubMed or Google Scholar to identify people who are publishing on heterotaxy. This can just sometimes help identify experts who are active in advancing heterotaxy care and really have an interest in treating heterotaxy patients. And finally, woohoo, here we are, we're doing it right now, connecting with other families and organizations who are really involved for guidance, right? And we don't pretend to be medical doctors, we don't play one on TV, at least I don't. We don't have medical authority, but what we do bring to the table is actual lived experience. And that is what we can share together as a community in which, we reach down to the patient family that's next to us when we have experience that we can share from what it's like to deal with these particular medical institutions or doctors from a parent perspective and how that's impacted our child. What kind of questions to ask? These are just some of the suggestions of kind of how you could approach that for a second opinion. You usually want to start with, what is your specific question? So, hey, I am hoping that you might be able to weigh in on fill in the blank, what's applicable to you on my situation with my child. And then, this relates to these. How many heterotaxy patients have you seen? Well, there we go. How many heterotaxy patients have you seen with a similar diagnosis as my child? What kind of testing or records do you need before you could offer an opinion? Is travel required? What is the expected timeline for receiving the opinion? How will your opinion be communicated to us? Will you talk to my child's current care team, or would you expect me to do that? What are the costs involved? Who in your office might help with getting insurance approvals if that is needed? The next thing, in one of the typical biggest holdups in getting a second opinion, will often having to do with medical records, right? Getting them from point A to point B can be a rather Herculean task, as we all know. So again, some of the suggestions: if your current team is collaborating with you, asking your current provider to do provider-to-provider records transfers if they can. That's going to be quick and efficient because they can really bring the second opinion provider up to speed very quickly on exactly what's going on and really know what kind of documents would be most helpful to that second opinion provider. Obviously, if you've been maintaining your own records, that can be enormously beneficial. So if you have always been keeping up with all, major documents on operative, cath, imaging, discharge reports, hospital hospitalizations, if you have that in the background where you're keeping your own records, this will be a great way to save on time waiting for records if you come to the point where you're seeking a second opinion. You can leverage patient portals and EMRs in these days. You can download visit summaries, test results, provider notes. Some EMRs now are coming out with ability to data share, like you can give explicit permission between two hospitals to securely exchange records, so you can always ask if that's an option. And really just keep checking your EMR to make sure that it's being regularly updated with all the information you need. For information that's not on your EMR or that you don't have in your own records, there are formal record requests that you do. Sometimes you can do that online. Sometimes you have to fax or send in paper, like we're in the olden days, to the health management system at your particular hospital. And so you would want to file those. There are special considerations for imaging and radiology. You just want to make sure that you are requesting full imaging files, typically in DICOM format, not just written reports. You want to see if your hospital can do this digitally. If they can't do it digitally, requesting a CD and confirm that wherever you're getting the second opinion can actually open and read the format that they're giving it to you. And definitely try to keep a permanent copy for yourself as well for your own. My computer is just not liking me today. For your own records. You will want to follow up if you've made any records requests. Note that hospitals are required by law to give you your records that you have requested within 30 days. If that doesn't actually happen, there are pathways at the hospital or with whoever is providing the records to escalate that further. All right, and then we move on to the next fun stuff after medical records is understanding insurance coverage. We are going to have a whole separate talk on insurance later, so I don't want to kind of dive too much into that, just kind of talking about this as the coverage relates to the second opinion process itself. So we talked about sometimes initial record reviews can just be provided at no cost. But there are times in which you might need to have an in-person visit. Specific testing or treatment is being requested in order to be able to provide you with the second opinion that you're looking for, and then that's when insurance coverage would come into play. So you would want to confirm with your insurer to verify that second opinions are covered. As an FYI, most major private insurances and public insurances, including Medicare and TRICARE, actually specifically cover second opinions as medically necessary, particularly when you are looking at a surgery or a major treatment is being recommended. So you would specifically mention this to your insurance company that you are looking for your second opinion, because that will trigger a certain category of coverage that you will be discussing, and you'll just want to confirm that coverage in writing. Some will require pre-authorizations. There can be issues with in-network and out-of-network coverage. You can request an exception because, again, as we said, there's not 100 heterotaxy experts hanging out in your backyard that you can just pick one and go. So if the expert that you need is not in your child's network, you can request an exception because there is no one in a network who could provide that opinion. That could usually need some supportive documentation from either your second opinion or your primary referring provider for that. And there are a whole bunch of challenges and caveats to that, but we are going to leave that to our amazing Allie, who will be doing our insurance talk a little bit later today. And so that finally just kind of leads us to our bottom line. And really, it's that the evidence is overwhelming that families who seek second opinions, no matter what the outcome of that second opinions are, feel that they walk away with meaningful benefit. They report increased knowledge, increased confidence, and a high level of satisfaction with their care. Some surveys consistently, 90 to 95% of families who seek second opinions report being satisfied with their experience and say that, more importantly, that their questions were answered. So families who pursue second opinions and otherwise actively engage in shared decision-making, Global Genes did a study, and these are families who report greater confidence, and they are twice as likely to describe themselves as well-informed and empowered in their child's care. So if or when you choose to seek a second opinion, you can feel confident that it can be a valuable and worthwhile step for you and your child. These are just a couple of resources listed up here that are not necessarily second opinion specific, but Global Genes has a couple of really great resources on becoming an empowered patient. The Patient Advocacy Foundation is a place that can help when you have insurance issues, particularly as it relates to secondary opinions or care that is a little bit more complicated. And then that's just the note for the Society of the Thoracic Surgeons Congenital Heart Surgery Database. And so, any questions or whatnot? Again, I'm Renee. You can also find me hanging around. But otherwise, that's all I got.